Now let's move to the right lobe of the thyroid gland. Now this is the right lobe in thyroid gland, this was the left lobe, and this is the right lobe of the thyroid gland, in which we see a focal lesion with a halo around. This is a halo around that measures approximately 2.8 into 2.4 centimeters. This is the mass. No calcification seen within it. However, there is seen cystic area with fluid in it at its lateral margin. So this is a thyroid nodule. In transverse section. Now if we go to the longitudinal section, this is the nodule, and it relates its echogenicity with the rest of the thyroid gland, which is normal. This is the normal thyroid gland, and the mass is slightly more echogenic compared to the normal thyroid gland. This is the normal thyroid gland parenchyma. This is the focal lesion at the medial margin of the thyroid gland, right thyroid gland. It contains internal cystic area filled with fluid. There is another focal lesion seen at the posterior lateral margin of the thyroid gland. This is the below. This is the carotid artery in longitudinal section, the landmark for the thyroid gland. And here again you see another focal lesion that measures approximately 3.5 centimeter into 2.4 centimeter. This is the right thyroid gland. And this is the nodule. And this is the fluid filled area, cystic area within this echogenic nodule. This is the nodule. Now compare the echogenicity of the nodule with that of the normal thyroid parenchyma. They are almost having the same echogenicity, the mass and the normal thyroid tissue. This cystic area within the mass or nodule in the posterior lateral margin of the right thyroid lobe is very much consistent with a CA of the right thyroid gland. Now you can see this area, separate area, which measures 9.5 into 14.0 millimeters, and this is the parathyroid gland. Parathyroid gland is always hypoechoic and should not exceed 5 millimeters in size. This is a hyperplastic. It is showing hyperplasia. This is the nodule. This is the nodule number 2. Now this nodule is relating to the medial margin of the thyroid gland, whereas this nodule is relating with the posterolateral margin of the thyroid gland. The echogenicity, this is a bit more hyperechoic, more brighter as compared to the normal thyroid. This is the normal thyroid tissue. This is the normal thyroid gland. This is the longitudinal section of the right thyroid, and so in this view we are seeing a hyperplastic parathyroid gland and two nodules, one at the medial margin of the thyroid gland and the second one at the posterolateral margin. This one, both of them contain internal cystic areas with fluid in it, and this is the common part of the common carotid artery. And this is very much consistent with aggressive pathology, possibly papillary carcinoma of the thyroid. However, we should not give the histological diagnosis, but the appearance is suggestive of these masses being of aggressive nature in the right lobe because of their appearance, because of the cystic areas, fluid-filled cystic areas within them, and the thyroid gland is also enlarged. Here is approximately 6.7 centimeters in length and 3.1 centimeter in anterior-posterior diameter. This is the common carotid artery longitudinal section, and these are the muscles, nodules. These are two nodules. One and two. This is normal parenchyma of the thyroid. Gland, as seen in the longitudinal thyroid,
49
nodule, again a nodule with fluid-filled cystic areas within it. So this is the study of the enlarged right lobe of the thyroid gland with the two nodules within it. Rest of the thyroid gland parenchyma seen normal and with one hyperplastic parathyroid gland that was seen and shown. And in the left lobe, this is the left lobe of the left lobe of the thyroid gland. It is normal in size. This is the parathyroid gland. This is the parathyroid gland. This is the common carotid artery. Normal thyroid normal thyroid parenchyma. Echogenicity, normal dimensions, and this is hyperplastic.